When we first met with the neurologist and he gave us the diagnosis, told us it was epilepsy, it was seizures, there weren't really any risks explained to us. Her epilepsy is triggered by sunlight. She would be riding her bike. The sunlight would get her, which sometimes would cause her bike to veer off into a car or up a curb, or if we were crossing the street, it was pretty terrifying.
There are certain risks associated with epilepsy that can include sustaining injury in the setting of a seizure, or unfortunately, for something more severe. Some physicians may not know about risks of epilepsy. It is very important to talk about everything related to seizure precautions and mortality, talk about wheels, heights, and water, and all the things we need to do to protect them while they have a seizure.
I don't know if they're afraid to tell us because it's so early on and they don't want to frighten us or frighten her. But of course, then we just immediately turn to the internet. Facebook parent groups can be a scary thing when it comes to epilepsy and hearing about mortality rates. Even if it's a hard conversation to have, the physicians, the neurologists, they're the experts at this, and we are coming to them because of that. If I was somebody who was diagnosed with it, I'd want to know. I'd want to know all of it.
There's a lot out there, a lot of information from peers or websites. Some of that information may not be accurate. Some of the barriers to decrease epilepsy and mortality have to do with education of the patients, the families, the communities about epilepsy.
If we had a greater understanding of the epilepsy mortality risks, we could kind of better plan for things and give her a better understanding of what to expect. It's important for families and it's important for people to know it's a possibility for themselves.
Some of the things people can do to take control of their epilepsy is make sure they take their medications every day. Seizure action plans, seizure diaries, seizure detection devices, all of these things are available for them to feel like they have ownership of their epilepsy.
We were able to quickly get the medication and start it. She wears hats whenever possible. We keep her in the shade whenever possible. We've invested in the blue lens light blocking sunglasses as well as swim goggles. She has a 504 plan at school. We try to keep her hydrated and lots of sleep. We've also gotten her into therapy.
Having patients have more control over the epilepsy, more control over what they know and what they can do about it, certainly can improve outcomes.
She doesn't love all of this, but she's taken ownership over it. She's thriving the best that she can. My hopes are that she lives a long, healthy, and successful life, that she can grow up and be a mom, travel the world, and be outside in the sun. It's always been my hope.